This video outlines the steps for completing the VTE risk assessment and prescribing VTE prophylaxis for a patient. So after logging into PowerChart and selecting the appropriate patient list, you can use the scroll bar across the bottom of the patient list to have a look at a couple of relevant columns within the doctor's work list. So first of all, looking at the VTE column, we can see that nothing has been documented for our patient, suggesting that the VTE risk assessment has not been completed. We can also see from the task column that one of the outstanding tasks to be completed is the VTE on admission form, as the patient has recently been admitted to the ward. So clicking within this cell opens up the task pop-up box on the right hand side of the screen, and we can have a look at what is outstanding. So we have the admission task of VTE on admission, which needs to be completed within 12 hours of admission. We also need to review the patient resuscitation state and also complete the VTE reassessment within 24 hours. So to complete the VTE on admission form, we simply click on Document. This opens up the VTE risk assessment. So the first step for completing the risk assessment is to select the mobility for the patient. So have a look at the options and select the option which is most applicable to your patient. So for this patient, they are a medical patient and they are expected to have ongoing reduced mobility relative to their normal state. So I will click within that radio button there. And this opens up the surgical and medical risk factors for the patient. So this part of the form has been divided up into thrombosis risk factors and bleeding risk factors, and that's been further divided into the risk factors which are patient related and the risk factors which are admission related. And as with any other mandatory field within PowerCharts, the yellow fields suggest that this is something that we must complete in order to submit this part of the form. So we just need to work through the different boxes to make sure that we have inputted everything that we need to. So for this patient, we've got a couple of patient-related thrombosis risk factors, and we've also got an admission-related risk factor. And as we complete these sections, they turn from yellow to white, and this patient doesn't have any bleeding risk factors. Looking at the thrombosis risk and bleeding risk, you'll see that based upon the information that we've inputted in the risk factor boxes, the thrombosis and bleeding risks have been calculated. So as the patient has both patient-related and admission-related risk factors, their thrombosis risk has been selected as yes and bleeding risk as no. And we've got some text here to prompt us to advise us on what we need to do now. If, for example, the patient was over the age of 60, this box would already be checked, as the system would know that the patient was over 60. But as with anything, it's really important to check over these boxes and make sure that everything that you select and that may be pre-selected is correct and appropriate for the patient. So once we've entered all the different risk factors, we click on this blue arrow to submit the form. And we now need to complete the prescribing section, and that is signified by the red asterisk. So click on the prescribing tab and click on add. And if you scroll here, you can see that we need to search for the VTE prophylaxis care set. So just start typing that into the box and select the appropriate care set, so the VTE prophylaxis care set, and we now have certain orders that we need to review and select. So we've got enoxaparin, and depending on the renal function, we've got a couple of different doses, and we've also got severe renal impairment options as well. So for this patient, we will select the 40 milligrams, and we now need to just check that the order details are correct and complete any mandatory fields. So as this is an order sentence, most of this information is completed for us. But we just need to select whether we want to give an additional dose now, which I don't want to do as the patient will be receiving one shortly. If we scroll down, we can see the other components that are within this care set and whether we want to add any other orders. So we can consider a full blood count if we wanted to, if that was relevant. And you can see here that anti-embolic stockings has already been pre-selected for this patient. So I'm happy with those orders, so I'm going to click OK and click Done just to get rid of that section. And then you can see here our orders. So we've got our anti-embolic stockings and our enoxaparin. So in order to sign off those, we just click Sign. And if we scroll down, we now have to complete this section. So has the appropriate prophylaxis been prescribed? And we're going to hit yes. If for any reason prophylaxis had not been prescribed and we hit no, then this field then becomes mandatory. But as we have, we'll hit yes. And now you can see that we have a tick next to each side, beside each component. So all we would then do is click the green tick to complete the risk assessment. You can now see that the tasks number has gone down from 3 to 2, and in the VTE column we can see that the VTE assessment has been completed and the patient has been identified as at risk. If we're then to enter the patient record, upon entering the patient record, we can review the information that we submitted as part of the VTE risk assessment, and we can check the orders that we placed as well. So looking at the order profile, if we scroll down, as part of patient care, we can see that the anti-embolic stockings have been ordered, and we can review the date and time that they were requested. We can also see that the VTE reassessment is still incomplete but has been ordered, and we can also see when this should be completed by. Looking at the medications, we can see that the enoxaparin, the dose and route and frequency are also listed. And then if we navigate to the documents section, we can see the risk assessment that we completed. So if we click here, this opens up the risk assessment form that we completed, and we can review the mobility status, and that corresponds with what we entered. We can also see the risk factors that we entered and the confirmation that we prescribed VTE. We can also check any medication that we prescribed by navigating to the drug chart, and you can see that the enoxaparin 40 milligrams that we prescribed is also displaying as expected. And that is how you complete the VTE risk assessment and prescribing elements.